This tutorial is going to show you how you can use your pre-assessment coaching report to help prepare for the objective assessment. Once you take the pre-assessment, there's going to be a hyperlink here that's going to take you to the coaching report. So if you click on this right here, you're going to find a coaching report that might look similar to this one. The first thing I would do is scan the topic areas and look for those that you didn't score as well. So unsatisfactory or approaching competence are great areas to look to see where you need to focus more when you're studying or preparing for the objective assessment. The other thing that you're going to see is a percentage of the assessment with each category. So in this case, 20% of the questions on the exam are under this category. So I really want to focus a lot more here than maybe I would on the 10% area, alterations in homeostasis. The next thing you can do is click on the heading, and this is going to give you more specific information about what areas under this main heading that you missed, or maybe that you scored well. So let's look to the right here. There's this little review button. If you click on this, it's going to take you to the chapter reading where the material may have been covered. It's not specific to the topics that you were tested on, so it is a little bit more broad in how it helps you. But if you're not planning on taking the pre-assessment again, and you simply just want to find out where to spend your time studying or how to study, the next thing you can do is click on the subheading itself. This is going to show you the actual question and the correct answers of questions that fell under this category. So this gives you a little bit more specificity as to what you missed and what you need to go and look up and focus on. The next thing that you can do is, again, take note of which areas that you need to prepare more, at least that it suggests that you need to prepare. We have two study guides, a pathophysiology and pharmacology study guide in the course tips area, and there's a list of topics under each of the systems. These are just topics that are commonly tested on, could be tested on, although it's not conclusive, meaning that if a topic's not on here, that doesn't mean that it's not going to be tested on, but this just kind of narrows it down a bit more for you, just a little bit. So we know from our coaching report that we need to focus on cardiovascular topics. So what you can do is go to this study guide and learn all about these cardiovascular topics. There's a suggested template below that shows you the different things that are important to know about each condition. So in this case, we want you to focus on what are the patient's common symptoms with that condition, what kind of physical exam findings you would see or vital signs. How would this condition be diagnosed? Is it laboratory tests? Is it radiology, cardiac tests? What is it that helps providers diagnose it? And then how is it managed once it's diagnosed? So pharmacologic treatments and non-pharmacologic treatments, and then anything miscellaneous that's just unique about the condition. I hope this helps you better prepare for the objective assessment, and feel free to reach out to your course instructor if you have any other questions.